Welcome, everybody. Thank you for joining us today. We're going to give folks a minute or two to keep on hopping in the Zoom, at which point we will begin. Thanks. All right. Hello, everybody. Thank you so much for joining us today for part one of a two-part series focused on breaking down the city and state budgets to help advocates understand the fiscal risks facing New Yorkers. My name is Liza Schwartzwald. It's great to be here with all of you today. I am the Director of Policy and Advocacy here at FPWA. Before we begin, a few logistics. As we do have a larger group today, the chat is disabled, but we encourage you to use the Q&A function you can access at the bottom of your screen throughout the presentation. Our team will address those questions during the Q&A portion at the end. We may not get to every question, but we will do our best. We're here today convening at the close of a particularly complex budget season, marked by a state budget that passed about 57 days after its deadline, followed by the city budget's passage last week. While government budgets have been balanced, at least for now, we know that New Yorkers are still struggling to make ends meet. At FPWA, we've been tracking this affordability struggle for years through our true cost of economic security and true cost of living measures, which break down the real cost New Yorkers face against the resources available to them. Federal policy, particularly cuts to the social safety net, are now exacerbating economic insecurity for our communities. Today, we'll break down the specific cost pressures New Yorkers face and examine how the city and state have used their budgets to respond to, and in some cases advance, fiscal support for these pressures. We hope this presentation, by identifying key fiscal risks, provides a useful foundation for your advocacy planning as we look forward to FY28. Now, with these goals in mind, we have a great presentation for you today. We'll start with Jared Launius, who has led our work on the true cost of living measure to ground us in the state of economic security in New York. Then we'll pass it to Emily Pisano, our senior fiscal policy analyst, to help us put this state of economic security in conversation with New York's fiscal challenges. She'll walk us through how this year's budget allocations impact New Yorkers' costs and resources, putting policies into the greater fiscal context. And finally, we'll leave you with a few key takeaways for how this budget should impact future advocacy and future additional resources. So Jared, take it away.
Thanks so much, Liza, and it is great to be with all of you this afternoon on this stormy afternoon in New York. Like Liza said, my name is Jared Launius, and I'm privileged to work with the team here at FPWA on a campaign to change the way we measure and understand economic need while pushing for economic security to be the governing standard in New York City and beyond. So before we get into what is in this year's city and state budget, we want to take a moment to situate ourselves in what the data say about the economic realities currently facing New York families. We want to understand the overall situation, and we also want to understand what communities are being hit the hardest. Now, as we know, government policies and programs are supposed to be responsive to the needs of the people. And one thing you have to do if you want to understand those needs is make sure you're looking at the right data. And as we know, the government doesn't always look at the right data. Historically, we've been severely limited in our ability to understand the true day-to-day financial pressures facing New Yorkers and the resources or lack of resources they have to thrive. The main data source that the government has used to understand household finances and inform policies and programs, which is the official poverty measure, doesn't distinguish between bare bones basic needs and genuine economic security. That's why New Yorkers voted in 2022 for the city to annually calculate and report the true cost of living because they knew the city was not seeing them and their circumstance. You cannot solve problems you refuse to see, and New York voters knew and felt that. Thanks in part to FPWA's research and advocacy, the city's true cost of living measure accounts not just what it takes to get by, but to get ahead. Our work with the Urban Institute on the National True Cost of Economic Security measure contributed to the city working with the Urban Institute in producing New York City's first True Cost of Living report, finally released earlier this year. Now, this measure accounts for a comprehensive set of household costs: housing, healthcare, childcare, food, transportation, disability costs, some forms of debt, as well as a savings target so that families can work to get ahead, weather emergencies, and plan for the future. It takes into account geography, family type, and the resources families have to meet their costs. Simply put, this is the most comprehensive look we can get at the household finances of New York City's families, how they are faring in the context of the costs that they are experiencing on a day-to-day day-to-day basis in their life. So as we evaluate these new city and state budgets, the true cost of living measure offers us a comprehensive look at how New York families are faring, where their pain points are, and where policymakers should be putting their efforts. So we're now going to get into the data. I'm just going to quickly note that there's going to be a lot of data up on the screen. We will share this slide deck with you all as a follow-up. So I don't want folks to get too concerned if you missed something or if you have a follow-up question. Obviously, you can put in the Q&A, and we will also make sure that folks have these slides as a follow-up. So you can see here on the screen what we learned from the city's first True Cost of Living report. This chart shows the costs faced by three basic household types and the resources they have to meet those costs. So as you can see, different households are affected by different costs at different levels, whether we're looking at adult households without kids, adult households with kids, or households with aging adults. I'll draw your attention in particular to the middle bars, which shows the costs faced by families with children, for whom the annual true cost of living is about $160,000 a year, which is nearly 5 times the cost threshold associated with the official poverty measure. And I want you to keep in mind, too, that these are typical or median families in these demographics. And there is plenty, obviously, as we know, plenty of variation among, let's say, for example, families with children, right? You have some families with children that it's, 2 adults and one 17-year-old kid. And then you have a household like mine, where it's 2 adults with a 1-year-old. And our childcare costs are very, very different, right? So the median childcare cost listed here is about $13,000 a year, but we know that there is broad variation. I can tell you from experience that I'm paying a lot more than $13,000 a year for daycare. So just that's something to keep in mind as context for what we're looking at here in these data. But the most important thing I want you to take away from this chart is that no matter which family type we're looking at, every single one of them has costs that well outstrip their resources, which is a clear indication, as if we need another one, that things are structurally broken for New Yorkers. And as a matter of fact, when we put it all together, we see that 62% of New Yorkers cannot meet their true cost of living, more than 3 times what traditional poverty measures show. New York City families with children are especially struggling. 70% of those households cannot meet their true cost of living. And I want to draw your attention to the column over on the right side that says average annual resource gap. What that tells us is that for those households that are not able to meet the true cost of living, those economically insecure households, they are $40,000 a year short of what they need. So in summary, roughly 2/3 of New York families cannot meet the basic threshold of paying their bills and setting aside a little savings every year. And on average, they are $40,000 short annually of what they need to be able to do so. And we know that economic pain hits different communities in different ways, particularly when we look across boroughs and across race and ethnicity. So this chart shows us a breakdown of the economic insecurity rate, the true cost of living rate for households broken down by race across the five boroughs. As you can see, and unfortunately, as not super surprising, the Bronx is struggling the most, where about on 75% of all Bronx residents are experiencing economic insecurity. Latino New Yorkers are particularly hard hit. Of course, so are Black New Yorkers and those from Asian and Pacific Island backgrounds. And the gaps are enormous in some instances. So within Manhattan alone, the gap in economic security rates between Hispanic and white residents is 52 percentage points. And that said, I really want to point out the number in the bottom right corner of this chart. 44% of white New Yorkers are struggling, even 33% of white Manhattan residents. And those are the most economically secure groups. This reminds us that while some groups are hit harder than others, everyone is struggling to keep up with the cost of living in New York. That also especially applies to caregivers, as many of us know. I already mentioned earlier that 70% of New York City families with children can't meet the true cost of living. When we look just at single parent households, just the single parent households, what we see is near universal economic insecurity. 90% of all single parent households cannot meet their true cost of living. And when we look at single parent households with three or more children, it goes up to 99%. So basically guarantees that if you are a single parent with three or more kids, there's no instances in which those families are able to afford the cost of living in New York. And as we know, parents are not the only caregivers that are struggling. New Yorkers supporting a disabled family member who requires care are also being crushed by the weight of these costs. It's particularly hard on disabled folks and their families, those who I should say are not do not have seniors in the household, because seniors obviously are eligible for Medicare and Social Security, which can help to defray some of the costs associated with caregiving. So when we look at households that have a disabled family member that requires care, and where, in those households, such households where there are no seniors, 91% of those households are economically insecure. Now, when we look at households with a disabled family member who requires care that do have seniors present, so they are receiving some form of Social Security and Medicare, it lowers the rate a little bit, but only down to 81% of those households. So those government programs help a great deal, but so much more needs to be done. And that's where I am going to wrap up my remarks before handing things over to Emily. Melena, if you want to jump to the next slide.
Thank you, Jared.
Wait, sorry, sorry, I'm so sorry to cut you off, Emily. I just got
Okay.
couple more points to hit. I'm so sorry. So before I hand things over to Emily, I want to just quickly make a few final points. First, as I just alluded to, I want to be very, very clear that government supports move the needle when it comes to the true cost of living. According to the city's report, national, state, and local government programs help to reduce the rate of economic insecurity from 67% to 62%, which is to say, if it were not for these programs, 67% of New Yorkers would be below the true cost of living instead of 62%. So they are helping. We know that they're helping, and things would be worse without these interventions. It's just a matter of, are they doing enough? Now, no single policy will close a $40,000 annual resource gap, which we identified earlier as the average resource gap for households that are below the economic security threshold, the true cost of living threshold. So going forward, it is going to take increasing wages and household supports, constraining costs, and dismantling the structures that keep families economically insecure. There is no silver bullet. It is going to take an all hands on deck approach. The True Cost of Living report measures what it costs to build toward economic security, and it provides us with a framework on where to make investments and at what scale to address the crisis facing millions of families in New York. It is crucial that we hold the government to account for what its own report says. The city is now on the record, no one can hide from it. 62% of New Yorkers can't keep up with their costs and set aside a modest and basic savings. When we go borough by borough or compare across race, family type, disability status, the findings are all the more stark. It is on all of us as advocates to ensure that this isn't a government report that just sits on a shelf, but that it gets embedded into the way the government does business and that it challenges all of us to think bigger about what needs to be done. So with that, I'm now going to turn it over to Emily. Emily, sorry for the false start, to talk us through what this year's budget does as a starting point in closing that gap, or not closing that gap, as it were. Thanks, Emily. Go ahead.
Thanks, Jared. That was so informative, and really sets the foundation for our budget conversation today. And before I dive into the next part of our presentation, I just want to take a step back to introduce myself. My name is Emily Pisano, and I'm the Senior Fiscal Policy Analyst at FPWA. I track budget developments at the city and the state level, and I regularly leverage this TCS framework to assess whether our fiscal priorities are aligning with New Yorkers' shifting costs and resources. So as Jared highlighted, with 62% of New Yorkers facing economic insecurity, really our biggest fiscal policy challenge is grappling with the scale of need in New York, both in breadth and depth. As we've heard, there is no single policy solution that will achieve economic security. Rather, we need to meaningfully shift outcomes. We need large-scale coordinated investments, not just at the city level, but at the state and federal levels as well. Unfortunately, that kind of fiscal coordination is not happening. Instead, the current federal administration has been actively undermining New Yorkers' economic security, and in the process, really constraining the state and the city's fiscal capacity. This makes it all the more pressing that we effectively prioritize our available resources to the challenges facing New Yorkers. So, over the second half of our presentation today, I want to ground us in those federal changes coming down the pipeline over the next year and look at how New Yorkers' FY27 budgets respond to those fiscal risks. Keeping at the center people's costs and resources. Through this exercise, we proactively identify resource gaps that can help you inform and align your advocacy strategies around economic security. And as a reminder, we will leave time at the end for discussion. So if you have any questions or comments, please drop them in the Q&A section that is enabled. So now getting into federal policy impacts. We are facing an unprecedented slate of cuts in FY27, something that can be hard to imagine given the onslaught of federal policy changes over the past year and a half. We know that over its short tenure, the current federal administration has essentially weaponized federal power for the benefit of the wealthy. So in HR 1, or the One Big Beautiful Bill Act, as we will no longer call it, the federal administration has coordinated its fiscal powers for that explicit purpose, attacking economic and racial equity, and dismantling major portions of the social safety net, diverting funding away from government and low-income individuals. So while this may seem like old news, many of the provisions in HR 1 are only now beginning to come into effect, with the largest impacts, particularly on healthcare, anticipated later this year. So you can see depicted in the timeline here some of the biggest near-term impacts of federal cuts to healthcare alone. Through a variety of federal policy changes, including the reduction of subsidies, ACA premiums, the imposition of work requirements, and changes to eligibility that block many immigrants from insurance. Around 1.8 million New York State residents are anticipated to lose access to their currently publicly supported healthcare. These losses will have devastating and direct impacts on New Yorkers' economic security for both middle income and low income New Yorkers, immigrant and non-immigrant alike. These federal policy changes have fiscal implications far beyond the programs they are affecting. In response to impending Medicaid and Medicare changes, private health insurance companies have begun requesting large premium rate increases for the following year, with average requests amounting to 38% year over year. I don't know if you got a letter. I did. While these specific rates still need to be negotiated, double-digit increases to families' healthcare is unsustainable. As costs rise, families that could previously afford health insurance may be forced to use savings or discretionary income, if they have it, to cover increased costs or face losing coverage altogether. And so with this diversion of resources, it really threatens the underlying economy. As households have less to spend, and the majority of households, less money is available for local businesses, for childcare, for housing, and for other necessities. And we could face cascading impacts on our wider economy. Unfortunately, we do not have the fiscal space to address many of these economic impacts and have an impending fiscal crunch. So with just Medicaid and essential plan changes alone, New York State districts are expected to lose 12.5 billion in federal funding, which for context is greater than the total projected revenue growth of the state this fiscal year. Moreover, fiscal losses will not be isolated to healthcare alone. Federal policy changes have deep impacts across all cost buckets that Jared highlighted, including food, childcare, housing, and community development. So in addition to federal programmatic cuts, the city is losing federal grant funding or money that flows directly into the city's coffers. On the left, you can see a selection of those losses. I know it's a kind of small chart, and you can look here and see at the top, the largest impact to a grant program falls on childcare and development block grants, with upwards of 850 million in anticipated loss funding. This funding loss, which would be a near 60% cut to the grant program, could really undermine the city's universal childcare effort. In total, when we add all these grant losses together, the city anticipates 2.5 billion less in direct federal funding than the year prior. So, with this understanding of the federal funding landscape, we can better assess how this year's state and city budgets that have been recently finalized mitigate impacts to New Yorkers' costs and resources. As many of you will already be aware, and as Liza highlighted, the City Council and the Mayor adopted a $125.8 billion budget for FY27 on June 30th, following the very late state budget adoption in May. And while the state and city managed to balance their budgets, allocations failed to address pressures on the lowest income households while pushing out a number of city costs into future years. So while the city managed to include major expansions to programs like universal pre-K, city housing vouchers, and fair fares, the budget does not address a number of federal funding gaps across healthcare, housing, and childcare. These federal losses really undermine the city investments and disproportionately fall on low-income New Yorkers. At the same time, while the city sought to address chronic under-budgeting across public benefit programs and policing from prior years, it still under-budgets a number of programs in housing and childcare vouchers especially, while pushing out a number of mandated costs. In past years, the city had relied on mid-year revenue adjustments to meet this chronic under-budgeting, but this year, city revenue forecasts are more ambitious and leave less fiscal space, even when taking into account the $568 million in new recurring tax revenues on wealthy New Yorkers, which includes the $500 million pied-à-terre tax. At the same time, as tax revenues are crunched, state grants that flow directly to the city are currently only 1% higher than the previous year. So if revenue does not grow beyond current projections, either from additional federal or state grants or from outsized tax growth, under budget costs could experience de facto cuts in the current fiscal year, and face further difficulties in out years. So it's in this constrained fiscal space that community economic security is really at risk. So over the next few slides, I'm going to break down this policy landscape to translate it into how it impacts the family's top costs and resource buckets. So first up, housing. While this year's budget did include some meaningful progress, investments really fell short for New Yorkers' top cost. Starting off on a strong note, FY27 budgets continue to build off previous years of tenant advocacy and really leverage government power as a market regulator. So while not in the budget, we were delighted to see the first ever 2-year rent freeze passed by the Rent Guidelines Board. And the state budget emulated some of this momentum, passing a law to expand income eligibility for the city's senior citizen and disability rent increase exemption programs, otherwise known as SCRI or JRI, in which the city covers any rent increases on market rate apartments for eligible tenants. The eligibility under this law was expanded from annual incomes of $50,000 up to $75,000, which, while significant, is still below TCL for the specific populations. So to complement these tenant protections, the city increased funding to Right to Counsel, which ensures that low-income tenants have housing course representation against illegal retaliation, including evictions and other housing issues. Similarly, in the vein of protecting access to housing, the city notably expanded its city housing voucher subsidies called City FEPs. The city increased funding for the program by over $280 million, of which $175 million goes to funding the expansion of the program that had been previously subject to legal dispute due to cost concerns. Under the new agreement, we largely moved forward with the expansion as passed by the City Council back in 2023, just adding clarifying language around eligibility and ensuring access to a housing voucher program for tenants below 50% AMI or area median income, which can reach potentially up to an additional 30,000 New Yorkers. So it's a big win. But while we were we were also pleased to see the city restore funding for CCHR, or the Commission on Human Rights, after proposing cuts in the executive budget. You might see some cuts here, but that is because it is compared against essentially real spending or what was modified. The agency, though, did have its funding restored, and it plays a critical role in enforcing protections against housing voucher discrimination, which makes apartments hard to find for those City FEPs voucher holders. Yet, despite the city's investment in City FEPs, federal cuts to Section 8 funding are undercutting the city's investments. In fact, when taking into account losses to the city's so we can see here around 30% cuts to Section 8 grants. And when we take into account that the city emergency housing voucher program is set to expire in December this year, overall rental assistance is actually projected to decline. So while this is concerning, there is a chance that the city can increase its Section 8 federal funding during the fiscal year to cover some of these losses. Congress just passed a bill called the 21st Century Road to Housing Act, which permits public authorities like NYCHA to transition up to 100,000 of publicly owned units to Section 8 vouchers. This transition would essentially enable the city to access more federal funding as well as private financing for affordable housing, but it would also reduce publicly owned housing units, which is a non-ideal compromise. The FY27 budget, unfortunately reflects this worsening or worsens this deteriorating financial position, decreasing NYCHA operations funding by $107 million. And while the city struggles to maintain its public housing stock, the market is struggling to create affordable units. In an effort to address claims of prohibitively high development costs, both the new federal housing bill as well as the New York State budget ease environmental review requirements for buildings. Still, it is unclear what impact this will have on housing development over the next fiscal year, since interest rates remain high and essentially undercut the incentives of easements. Moving on to healthcare, we see a similarly challenging outlook. As discussed previously, federal cuts to health insurance are set to take effect this year, with millions expected to lose health coverage. Unfortunately, the FY27 state budget did not stem those losses. In particular, the state failed to provide funding to protect the expansion of the Essential Plan, a COVID-era policy that ensured those up to 250% of the federal poverty line could access free health insurance. Now that the program is being rolled back, about 450,000 New Yorkers are expected to lose their affordable health care. The city is unfortunately unable to step in to stem those losses. Its Medicaid spending is legally capped by state law. So rather than fill coverage gaps, the state budget invested in stabilizing and alleviating impacts to its hospital system. On that vein, the state's FY27 budget did include funding to increase hospital and nursing home reimbursements using kind of some MCO funds. By increasing those reimbursements, the state supported healthcare finances or institutional finances, including, we should say, needed wage increases for workers. Earlier this year, the New York State Nurses Association organized to win large wage increases as well as improved safety protocols. And to add on to this, when the state budget amended Tier 6 pension plans, which are the pension plans that support nurses along with other workers, to reduce employee payments into the program and allow for earlier retirement. So some of these changes actually help nurses meet their cost of living, and they also make healthcare more attractive for workers to fill staffing shortages. Still, in spite of these institutional supports provided by the state, H&H, the city's hospital system, remains underfunded or under-budgeted in the city's adopted budget. This reflects that even with institutional supports, the hospital system remains fiscally precarious. At the same time, New York City's budget failed to fund programs that bridge access gaps created by insurance losses, potentially further exacerbating community health. So for example, the city budget actually cut funding for universal home visiting by nearly 10%. Turning now to childcare and K through 12 education, which is the third largest cost bucket for families. While the true cost of economic security measure doesn't formally include K through 12 education in its estimates, we view both childcare and education as essential to economic security. They support parents' ability to work while investing in children's thriving and long-term success. Unfortunately, the fiscal outlook here also remains challenging. Again, federal losses are straining the childcare system. New York City expects to lose approximately $890 million in annual childcare and development block grant funding, which is a reduction of more than 60% from the previous year. This follows last year's elimination of the federal Head Start grant to New York City, which had provided more than $70 million in annual support to disadvantaged children. And when we take these together, federal actions represent nearly $1 billion in lost targeted childcare funding, making childcare one of the areas facing the largest direct fiscal impacts of federal cuts. So, while the state made historic investments in early childcare education with $1.1 billion in grants to New York City, enabling the expansion of the universal pre-K program and the establishment of a 2K pilot, much of that new funding offsets the $1 billion in federal cuts. For example, the state made historic expansions to its childcare voucher funding, earmarking up to $475 million in matching funds for New York City specifically. But this funding is really insufficient to make up for those federal block grant cuts, particularly given the city's 25,000 long childcare voucher waitlist. Making matters worse, the city did not allocate sufficient funding to receive the state's full match, only allocating around $385 million, leaving an additional $90 million of state funds on the table. When taking universal pre-K and voucher funding together, the city's budgeted investments in childcare, in fact, decrease by $450 million, potentially leaving structural gaps for childcare funding. So, while the city struggles to fill childcare gaps, it is also simultaneously dealing with state K through 12 education funding losses. Last year, changes to the state's school aid formula reduced the funding New York City would otherwise have received by more than $314 million. This year's budget only partially restored those reductions by increasing funding weights for students experiencing homelessness and English language learners, bringing approximately $168 million back to the city. Meanwhile, the cost of education mandates are increasing. So to control the spending, the city has budgeted to save money by reducing its reliance on public sector in education. Private sector in education. For example, the city is finding savings on due process cases in which the city provides vouchers for private school when a public school is deemed unable to meet a student's special education needs. So while the city has invested additional funds to help divert those cases into public special education, it remains unclear whether those savings can be achieved without affecting service quality or access or effectively diverting those cases. Moreover, these future savings are not enough. The city will also delay its mandate to reduce class sizes from FY27 until FY29. Taken together, we can see that although both the state and city increased investments in childcare and education this year, much of that funding is being used to backfill losses or defer future obligations. Okay, turning now to food security, which is a smaller share of family budgets, but an area where many New Yorkers struggle. 1.4 million New Yorkers face food insecurity today as food prices rise and federal nutrition assistance is reduced. Recent federal changes to SNAP eligibility have caused an estimated over 43,000 New York City residents to lose their benefits. And at the same time, Congress threatens to cut further funding from nutrition programs like WIC. Unfortunately, the state budget did not meaningfully increase funding for food, leaving the city to deal with those increased needs. The city's FY27 budget did increase its investments in SNAP, and it also provided capital funds for the first city-run grocery store, which are all positive steps. Additionally, the city did provide more money for Community Food Connect, which is the city's food pantry program, but funding levels actually remain below the amounts requested by advocates and still could leave food pantries stretched as monthly visits are up 84% since the pandemic. Closing out our summary of family costs on a more positive note, the city was able to make significant investments in transportation. The city budget expanded eligibility to the city's half-price transit program called Fair Fares from 150% of the federal poverty line to 200%, making an additional 1.3 million New Yorkers eligible for the discount. While this will meaningfully reduce riders' costs, eligible riders will still need to apply because automatic enrollment was not adopted as part of that agreement. Meanwhile, the mayor's free bus program remains unfunded, leaving the Fair Fares expansion as a sort of interim step towards a wider goal. So now that we've covered the cost side of things, I want to actually turn to the resource side of things and how how the city budget affects New Yorkers' resources to manage those costs. As mentioned by Jared, TCOL data shows government programs increase resources meaningfully and reduce the level of economic insecurity for families. But as federal support declines and the city and state struggle to fill the gaps, family share of government resources is expected to shrink quite dramatically. The FY27 budget does not address the resulting cash flow issues that this causes for families. That being said, I do want to first recognize that the city budget provides funds that do meaningfully increase access to resources for families. So we want to applaud the city for expanding a program called New York City Rise, which increases the city's contribution into a 529 college savings account from $100 to $1,000 for every single public school kindergartner, which is a major and meaningful long-term investment in children's future opportunities. However, there is, and I should say that the city baselined under budgeting of cash assistance, ensuring that New Yorkers that need that cash assistance will be able to access it. Unfortunately, the city budget did reduce funding for a number of programs that help New Yorkers afford their daily costs. So the city eliminated its guaranteed income pilot program and cut home energy assistance, which helps lower income residents cover their utilities. Similarly, the budget did not provide funding to help increasingly cash-strapped community-based organizations. On top of high costs and grant losses, CBOs continue to face payment delays from the city, which strains their organization's ability to actually cover their costs and pay workers. And rather than invest in administrative improvements, we actually see that the FY27 budget reduced funding in the Mayor's Office of Contract Services, which could potentially worsen payment issues. So in this environment of financial precarity, fair pay remains out of reach for human service providers. The state failed to provide adequate COLA for human service organizations, only providing a 2.7% annual increase, which really does not keep pace with cost inflation. Similarly, the state did not provide $500 million in funds that advocates hoped would be used to improve wages for childcare workers, leaving the sectoral wages far below the true cost of living. So while on the city level, there were some funds advanced, roughly $40 million was provided to improve childcare reimbursement rates. Major investments are needed to bridge pay gaps. City administration has sought to stand behind workers and has significantly invested in its budget in the Department of Consumer and Worker Protection, but it faces major challenges in actualizing increased wages. Concerningly, we saw that the FY27 city budget drew down its reserve for collective bargaining by around $300 million, despite upcoming labor negotiations this summer with DC 37, which is the city's largest public sector employee union. This reduces the city's budgeted funding for needed wage increases, which could conservatively cost the city billions in wages that is not currently included in the city's budget. Further exacerbating the crunch on wages, the city has reduced investments in certain programs that help expand economic opportunity. So while the adopted budget did restore community college funding following proposed cuts in the executive budget, small business services have been slashed and workforce credentialing programs like Advance and Earn have been eliminated. And when we take these together, these reductions really narrow the path for New Yorkers to increase their earnings. So I know that was a ton of information, so I want to just leave you with a few takeaways before moving to questions. With cuts to funding, with the scale of cuts to funding, we really need to come back to that true cost of living framework to make sense of the year ahead. The too long didn't read is that costs for New Yorkers and government are going up and cash is short, potentially undermining economic security. We know that federal changes are driving those resource gaps and leaving families' largest cost buckets of housing, healthcare, and childcare the most exposed. And we know that the state did not make up those gaps. This means that even as the city administration remains committed to advancing policy for working people, the city is facing real fiscal constraints. As advocates, our role is to be honest about where the budget falls short. It's starting with an honest assessment that is the foundation for the collective action that we really need to make and win meaningful change. Framing the challenge as a resource gap can actually help us in the next fiscal year and make that case for new revenues needed to support the kind of wide scale investment that is needed. So we really want to, as we look ahead, leverage the state's role in the full scale of New York as a grantor, as a tax authority, and as a partner that can negotiate with the federal government to generate the investments needed to support New Yorkers. Ultimately, though, this comes back to the TCOL framework. And so we need to make sure that we are centering on, rather than managing poverty, around that wider goal of moving towards economic security. Can go to the next slide. In the meantime, to help that effort, we hope that you join the National True Cost of Living Coalition that Jared leads. And we also want to, if we go to the next slide, can show we will be having forthcoming information on the budget that kind of breaks down some of this data that I talked about today. So please, follow us and look out for more information. And we can move to questions.
Excellent. Thanks. And the Q&A is still open, folks. So now that you've heard the presentation, feel free to continue dropping in questions. So I'm going to start off with the first question I see here, Emily, which is, how did the budget change from the executive budget to the enacted budget? What was different?
Yeah. So we saw on a big picture level, we saw that the revenues of the city actually went up. So they had proposed a 124 point something billion dollar budget, and we saw about $1 billion increase. They found that money essentially by a few ways. They reduced fringe benefits and that collective bargaining reserve that I talked about. And they also increased estimates of the city's business tax, which essentially came from some of these decoupling from federal provisions that were included in the state budget. So we had more funding, and then you had some major wins there. So you had City FEP's expansion that was previously not included. You saw some baselining of agency funding like the Commission of Human Rights. And you saw some, essentially there were a lot of places that funding moved upwards.
Great. Now I see here a comment that says, big lesson here is that cities across the US need New Deal era level funding, federal funding infusions to provide critical services. How do we begin a national pressure campaign to force our officials to end punitive austerity budgets? So Jared, I'm going to start with you, and then Emily, if you want to add after that.
Yeah, for sure. It's a great question, and it's a big question. And at FPWA, we cannot necessarily we've got to sort of know what our strengths are. And one of our strengths at FPWA is the work that we are doing to truly understand the scope and the scale of economic struggle and economic insecurity in the country. So obviously at the city level, we've been working on the true cost of living measure. At the national level, we've been working with the Urban Institute on the true cost of economic security, which is a national report that provides a lot of these same data that we were looking at earlier for the entire country. And what we see at the national level is not all that different from what we see at the city level. Nationally, 49% of Americans are living in economic insecurity, according to that analysis. Of course, there are regions that are doing better than others. There are groups and demographics that are doing better than others. But that is more than what, nearly 4 times about what the federal poverty measure says is happening with households in terms of economic struggle. And so one thing that we're pushing for and the work that we're doing at FPWA is trying to socialize that data at the federal level with federal delegation, with folks that are talking about these things in the media and in the halls of Congress and the halls of power. We hope to, at some point, have the opportunity to push for adoption of a national true cost of economic security measure at the federal level so that the government is forced to measure what it actually takes to live with economic security, not just to get by, and to use those data like they use the poverty measure or the unemployment rate to directly inform policy. So that is where our emphasis area is. That's where our strength is in the measurement and understanding exactly the scope of the issue so that we can then have the tools to advocate for what we need. You cannot measure what you do not see. And right now, we are not seeing this true scope of economic struggle across the country. And so for us, that's certainly a starting point. And so we just had on the previous slide, and we'll send out information on the work that we're doing at the national level, where you can learn more and get in the loop. So that's, I guess, what I would say. And thanks for the great question.
Yeah, and I'll just add on to that by, I mean, echoing everything you say. But I also think that so the work at TCOL is part of this wider campaign.
I think Emily just unfortunately lost her internet as she was delivering what I'm sure was an excellent point.
Absolutely. Thanks, Jared. So while we wait for her to
Uh,
reconnect, oh, there you go.
oh,
Emily, we lost you for just a moment.
okay.
So if you want to just re-answer that, go
I'll
for it.
take that as a sign that my answer is not needed. Echoing everything Jared said, and really just really thinking that, all of the work that we do at the city and the state level is really a part of a wider political campaign that we hope has, cascading effects into the federal narrative.
Excellent. All right, then we have a few more questions in the chat. So the next one, Emily, I'm going to direct towards you, and this is a question about the city's cuts to the home energy assistance program.
Yeah. This area is another kind of surprising area that I saw when digging into budget documents. Home energy assistance related to, it's related to federal and state grants. So what we're seeing here is that there's under budgeting of the program. This doesn't necessarily mean that it will result in cuts to families. What we see a lot in budgets is that they under budget federal funding that will eventually come through. So it's still a risk because that federal funding may never appear. But it does, it does mean that there's a structural gap, here essentially. So there was around 23 million in funding that is under budgeted from previous year spending. And that echoes kind of a lot of things that we're seeing across the budget. So I know the city made a big deal of kind of fixing a lot of under budgeted costs or addressing under budgeted across cash assistance, across various public benefit programs. But there are a number of other programs that are also under budgeted. So, there are gaps, billions of dollars in gaps, essentially.
Thank you, Emily. Now, you had mentioned earlier in the presentation, I believe the question about to share is somewhat related to that one of the savings measures was lowering the amount of money in the collective bargaining agreement. or the collective bargaining pot. And there are several union contracts that we know are expiring this year, either now or in November. So how are those generally accounted for in the budget? Looks like perhaps we are having some more connectivity issues. Let's give it a moment.
Yeah, I've lost Emily too on my end.
Okay. Right. All right, just give us one moment, folks, where we get her back on. She'll be here just a second. We're having some Zoom shenanigans, which of course always happens on hot and rainy days in New York. Emily, welcome back.
Thank you.
We're good now. So if you didn't hear the question, it was how do the savings in the collective bargaining pot, how are those generally accounted for given the upcoming union contract negotiations that we're going to see from DC 37 and others in November?
So if I understand your question correctly, how does this differ than previous years of collective bargaining?
Yeah, does it? And if so,
yeah, what I will say is that it is actually they're sort of at a standard position right now. So there's this collective, what they budget for salary increases, and then they have this fund called the collective bargaining reserve that allows for, wiggle room above what that budgeted amount is. Currently, according to the executive budget, the number hasn't been published at the adopted budget yet. The city is budgeting around 1.25% for worker increases, which obviously is well below what a collective bargaining agreement will reach or hopefully reach. That is actually sort of a standard position for the city around this time. It's a negotiating position. And the collective bargaining reserve, it is at a sort of standard level as well. But what we are facing is that we want to make significant increases to workers' wages, given the resource gaps that we just talked about. So there is, for every percent increase, the comptroller estimates that there's around 550, that costs around 550 to $600 million. So that is, funding that needs to be found in the city's budget, and we're already seeing some of those revenues constrained.
Thank you. And it looks like we've got 2 minutes, so let's try for one more question. What are your thoughts on the challenges related to new revenue generation at the state and or city level to cover some of the federal gaps and unmet needs of New Yorkers?
That is a big political question. Yeah, so I think there's obviously the question of taxes, and getting the state behind increasing taxes, or allowing the city to increase its taxes. There were, some wins in this budget with the pied-à-terre tax, but we really do need larger scale investments. So I think that will be a big challenge looking forward at the next fiscal year. And how do we do that in a way that is equitable, that actually, brings down the top, brings down that top bucket and increases the resources for those at the bottom. And I will also add that, the challenge is with the uncertainty around this federal administration. So we see kind of under budgeting of some grant programs, and there's sort of always a push and pull of like, who's going to fund this? And it's not fair that low and middle income New Yorkers get caught in that game of chicken.
Thank you. Yeah, so we are just at 3 o'clock. So I'm gonna stop us here, but I would love to remind everybody this is part 1 of a part 2 webinar series. So we will be back early in the fall to do a bit of a recap and also to share what we have learned over the summer to help everybody as they really start putting nose to the grindstone for your campaigns and your work going into FY28. So thank you so much again to all our wonderful panelists for joining us, for all of our participants. And as I said before, we will be sharing out the deck and recording of this after we close out. So thanks so much again, and have a great rest of the day.